Hello everyone. Today we have Lisa Shah from Twin Health, Chief Medical Officer, joining us, and we are right here recording at HLTH Vegas. So bringing to you another episode with a fascinating health executive who is going to tell about how she is changing the world for good. Hi Lisa, how are you?
Hi, Ayush. Thank you for having me.
Yeah, glad to be connected, especially at a stage like HLTH. So, Lisa, tell me more about what drives you becoming a health executive, and you have been a practitioner, and now you have taken up a role as a technology executive. So, tell us more about that journey and what drives you.
Sure, thank you. I am an internist by training, and most of my career I've been in the research world. But about 15 years ago, I moved into the space of value-based care. So really helping in the United States in particular, how do we control the increasing spend on healthcare with poor outcomes that we're seeing in the clinical world. And I've spent the last 15 years of my career really trying to solve for that by creating better clinical outcomes, but also figuring out the ways to most effectively reduce unnecessary spend, improve prevention of disease, better treatment, and better patient experience. So my purpose at Twin has been really now, for years I've been working in companies that have been really focused on managing diseases with medications, but the reality is certain chronic metabolic diseases, like the ones we take care of at Twin Health, over time just continue to get worse. At Twin, we use artificial intelligence technology and build a whole body digital twin replica to reverse chronic metabolic diseases. So I'm very excited, here at the opportunity of actually not just managing a disease, but actually healing the body and making the disease, if you will, quiet and removing the need for medications.
So, great. Thank you so much, Lisa, for sharing that introduction and your purpose. Because at Health Tech with Purpose, it's very important for us to, understand the purpose that defines actions for different people. So, tell us more about, let's go deeper into the work that is happening at Twin Health and how Twin Health has been helping people with the sensors, with the solutions that it has built. I've heard great reviews that I've seen about Twin Health, so tell us more.
Sure. So at Twin Health, we use digital twin technology, which has been used in other industries, and we're the first commercial application of digital twin technology to build a whole body digital twin or a replica of human metabolism. So using advanced sensor technology, wearable sensors, as well as data from blood work, we are able to take in multiple data inputs, and through artificial intelligence and machine learning, we can create a blueprint, if you will, or a replica of a human's individual metabolism. We can use that information real time to help give recommendations back to patients of things that they can do in their life that are very precise to them and specific to them to help reverse and heal their disrupted metabolism.
Would you like to share a patient journey or a story that comes to your mind? One of the best memories of.
Sure. Oh, we have so many. So in the way it works with Twin is when patients come to us, they have some chronic metabolic disease, whether it be diabetes, pre-diabetes, or obesity, and many of them have other conditions like hypertension or dyslipidemia or even non-alcoholic fatty liver disease. What we do at Twin is we help these patients. We take their blood work, give them the sensors, build this replica. We pair them with a very compassionate care team, and we help coach them. And most of our patients, when they come to us, they're very excited about Twin because they've tried lots of things to control their diabetes or to lose weight, and none of it works, right? They've tried medications. A lot of them don't want to take insulin, and they don't want to, inject themselves. They've tried diets, they've tried exercise routines, but they're too difficult to sustain. And so when they come to us, they're hoping for something different. And it's very exciting that in just, on average, in under 6 months, we have been able to reverse type 2 diabetes in 72% of our population. We've been able to eliminate high-cost medications in 71% of our population. And at 6 months, the average weight loss is 16.5 pounds in our population. And so a couple of stories that stand out to me is One of our patients came to us with a hemoglobin A1C up in the 9s. It's pretty significant diabetes. Also on 100 units of insulin, plus 3 other diabetes medications.
Oh.
And in 180 days, he was off all of his medicines.
Oh, wow.
His A1C had gone down to 5.6, and he had lost 60 pounds.
Great.
What I love is not just that their clinical values are better and that they feel better, but that they are so happy and they say my symptoms are gone, I have more energy, I'm sleeping better, I have more time with my children because it's more quality time. So for me, giving people back the gift of life is what we hear from a lot of our patients, and that for me is very rewarding.
Great. I mean, that shows the kind of impact that technology can create, really. I mean, if you are able to treat someone with chronic illness of a long time and,
Yes.
bring them to a new lifestyle
Absolutely.
altogether without, I think, making those like big changes in their lives, I think that makes a lot of difference.
Yes.
So tell us a bit more about the impact in terms of numbers, if you can tell, like how many patients, how much cost, like, any numbers that you can share.
Yeah, so we're not really able to disclose the number of patients we have, but we have done this on thousands.
Okay.
And, one of the biggest things for us is our ability to save cost. Some of our partners see thousands of dollars in savings on drug spend. There's a particular class of drugs right now, known as the GLP-1s, that have been out in the market. They are extremely expensive. They run upwards of $12,000 a year for the employer or for the health plan. And we have been able to eliminate 91% of these drugs in our
nice.
population. And so you can imagine how much cost savings. We're also able to, by reversing type 2 diabetes and removing diabetes from somebody's life, you can imagine all of the downstream cost that is coming later for these patients that we're able to prevent. Hospitalizations, surgeries, cardiac events.
Yeah. That's great. That's great. And so I believe that today's solutions are built more like sensors is one of the major aspect of your technology. But talk to us more about the data and the AI aspects.
Sure. So AI, as you know, is a buzzword right now. Everyone is talking about artificial intelligence. But for us, the digital twin technology is really this idea, and it's been used in other technologies like autonomous driving cars, right? Self-driving cars or planes, airplanes. And what we do basically is because we're taking 3,000 data points a day from our patients, we're getting them both through the wearable sensors. So we use continuous glucose monitors, we use Bluetooth blood pressure cuffs, we use fitness trackers that look at sleep, respiratory rate, heart rate, they look at exercise and activity, and we also use a Bluetooth scale that patients can stand on, but also measures visceral fat around the organs. We're taking in over, 3,000 data points a day. We're also taking in self-entered food logging, our patients' blood work, and all of this, including behavior preferences. So patients can tell us, I don't want to eat this food, or please don't take this food away from me, or I will never walk outside, I prefer to bike. We can take all of that and feed it to build the twin. So that when patients get recommendations, the recommendations they're receiving are very specific and precise to them. And the way the AI and the machine learning models work is essentially they build a digital twin of the patient and match it to thousands of digital twins that we have in the cloud, right? And they self-learn. So they're self-learning models where patients will, over time, as we get more and more data from them, we will be able to refine their digital twin to be more precise and more specific to them. And what it's really looking at is, so let's say for you, maybe today you eat the same exact thing that you ate yesterday, but you have a completely different reaction in your glucose or in your heart rate. The twin can notice that. And what it's looking at is what happened yesterday, or did you sleep differently, or did you do less exercise, or maybe today you're walking so much more that you have a different glucose response. And it takes all of those things in to figure out specifically what matters the most for Ayush.
Okay, good to know, Lisa. So, you have been building this for 5 years, and I believe that we see that we are in the times now that technology and hardware and software and patient awareness all coming in together. So what do you make of the future? Like, what do you see like coming up next, both on the opportunities and the challenges?
Yeah, well, first I think, there are still a lot of challenges. Artificial intelligence and the data we have is so much power and it's so incredible. And I think one of the things we have to figure out is how do we bring not just the patient and their data, but the whole ecosystem of healthcare. So providers, physicians, primary care, health systems, hospitals, electronic medical records all together to be able to create, a place where the patient's record is complete, right? And all of this data is integrated. And that is a big challenge. I think also there's a lot of solutions out there, and how do companies make a decision and which ones they use. What I think is the opportunity for Twin is because of our technology and our ability to heal metabolism, we can actually solve so many chronic metabolic diseases. And a lot of organizations are really, caught up in this point solutions where they have one solution for diabetes, one solution for weight, one solution for blood pressure. And for us, it
could be more holistic in nature.
We have this opportunity to offer all of that. And that's what gets me excited. I also think there's a lot of opportunity in the future for what we do as sensor technology improves, right? We don't create our own sensor technology. We buy it and purchase it from elsewhere. And there's always research and development happening in the wearable industry. And for me, I'm really excited to see what other data can we get that can help us with things like Alzheimer's disease or Parkinson's or all of these other conditions that we know are very related to human metabolism and to lifestyle choices.
Right. So having that modularity can really help for you guys to add more modules basically into the system, but add more sensors, add more possibilities of being able to measure at the cause.
Yeah, and we don't have to create a bunch of different programs because it's all the same thing. It's mapping the human metabolism and then figuring out how different inputs create a different response in a patient, and being able to understand very clearly in a way that the human mind is not capable of the cause and effect, right? Is it the food you ate, or is it your sleep, or is it your stress, or is it that you have COVID? What is it that is making your body respond this way? And when we know that power, that information is incredible for the patient, it allows them to have responsibility for their own health. And I think the problem we're solving today is when patients go to the doctor, they have 10 minutes and the doctor says, eat better, sleep better, exercise more, and it's very, non-granular, non-specific. I think with something like Twin, you're putting the power of making decisions in your lifestyle that can impact your health in the hands of the patient.
And I think reminding every day and in a language that the patient can understand, that makes a lot of difference.
Exactly. In a way they, like everything else they do in their life, it's easy.
Great. So, Lisa, closing thoughts. What are the we talked about the opportunity. Any challenges that you see in the growth?
Yeah, I don't see challenges in the growth per se, but I do think, some of the challenges we have right now are really around thinking about how do we get this to everyone. Right now, we work with payers and health plans and employers, and so if somebody loses their healthcare coverage, they would lose Twin. And so, we want to be at a place where we can scale this so much so that if a patient switches jobs or a member switches jobs, Twin is offered at their company too. So for me, one of the biggest challenges is making sure that we can give access to Twin to everyone, and that we can continue to, have impact on not just the United States, but hopefully globally.
Thank you so much, Lisa, for joining us today. And it has been a really great conversation, learning about digital twin.
Thank you, Ayush. It was great talking to you. Have a good day.